What are the signs that you might have pelvic floor dysfunction? Let's talk about it. Pelvic floor dysfunction means that the muscles and ligaments that hold your pelvic organs in place are stretched out. Pelvic floor dysfunction affects 25% of women in the United States. Pelvic floor disorders are defined as urinary incontinence, fecal incontinence, and pelvic organ prolapse. Pelvic floor dysfunction can affect women who've been pregnant, and especially after a vaginal delivery of a very large baby or multiple deliveries. Pelvic floor dysfunction can happen post-surgically when the pelvic floor muscles that hold your bladder and uterus in place are weakened. Signs of pelvic floor dysfunction are a bulging sensation in the perineal or vaginal area. Pelvic floor dysfunction can cause urinary incontinence, particularly stress incontinence, where you cough or sneeze and lose a little bit of urine. Pelvic floor dysfunction can also cause urinary urgency or difficulty initiating urination. Pelvic floor dysfunction can also interfere with proper bowel movements, as the rectal vault is not well supported and you may have trouble having a bowel movement, or you cannot control your bowels with involuntary loss of stool. A vaginal herniation called a rectocele is when the backside of the vaginal muscle nearest the rectum separates. The rectum tends to push up into the vaginal area and it's difficult to have a bowel movement. Uncomfortable intercourse can also be a sign of pelvic floor dysfunction. One of the issues with pelvic floor dysfunction is it often interferes with high-impact exercise and activity because jumping around can cause you to lose a little urine. What can you do about pelvic floor dysfunction? Physical therapy includes doing Kegel exercises. It's one of the best ways to retrain your pelvic muscles. If you're menopausal, you may need some vaginal estrogen to help increase circulation and tone the vagina while you're practicing Kegel exercises or doing vaginal physical therapy. I did make a video on how to do physical therapy for pelvic floor dysfunction. If you need any more information about pelvic floor dysfunction, please join us in our Hormone Reboot Training. I'll see you in the next video.